So our speaker is Dr. Margaret Makanyengo. So Daktari is an established consultant in the area of psychiatry with a master's in medicine in psychiatry. She has over 32 years of experience in child, adolescent, and family psychiatry and palliative care in HIV and AIDS. For the last 24 years, she has been in charge of mental health services at Kenyatta National Hospital, and she has a number of achievements for the 21 years that she served there. She's the founder of National Health and Development Organization, NAHEDO. This was done in 2004, an NGO that addresses health, research, and development. Now, through NAHEDO, she partners with Daktari Online to provide online courses on mental health, including spirituality and mental health. Daktari received an award in 2012 of Moran of the Burning Spear by the 4th President of Kenya, that is His Excellency Uhuru Muigai Kenyatta. In addition to all that, she works at Oasis Mental Health Hospital, where she practices psychiatry, and she is also an ordained reverend, and she runs the chaplaincy at Oasis Mental Health Hospital. I would want to give her this chance to pick it up from there, and in a few minutes, I will be sharing her presentation on the screen. Daktari, welcome.
Hello, thank you very much. I hope you can hear me.
Yes, we can hear you very well, Daktari. Go ahead.
I was also hoping you could see me. Yeah, it's good to see me, Kidogo, because you never know with the AI, sometimes you could be talking to a computer and you think you're talking to somebody. Yes. So good evening, everybody. I'm happy to see we have counseling psychologists and mental health specialists, but I think the topic will be relevant to everybody, whether so long as you're a parent, you're a human being, you're a Christian, and even a non-Christian. Yeah, it's important across the board. Yeah, thank you very much. Okay, so today I've been asked to talk about, just go back on the first slide, please. Thank you. About children's mental health and suicide risks. And I know this is an important topic, rarely discussed, yet it's so important. So before that, I want to just describe what is mental health. Before we talk about suicide risk, we need to understand what mental health is. So we go on to the next slide. The next slide, please. According to the World Health Organization, there is no health without mental health, because people basically believe that health is when you are not having pain, you're not having malaria, you know, but if you are physically healthy and you're not mentally healthy, you're not healthy. And they have gone on to define health as a state of well-being in all 4 areas. So we look at ourselves and we see we can be physically healthy, but for us to be healthy, we have to be also mentally healthy, spiritually healthy, and socially healthy. So we look at the physical state. Are you healthy physically? That's on your body, yeah? Are you healthy socially? Meaning, are you relating with people well? Are you interacting with people well? Because you may be physically healthy, but you're alone and you don't talk to anybody. Usually that's a sign of a problem, yeah? Mental health, which we're gonna talk about, and spiritually healthy. In my experience as a consultant, I've learned that we are all spiritually wired, yeah? And everybody, even the atheists, they don't know that they're actually spiritual, yeah? Because actually research has shown that there's a part of the brain that God created, that when you go to take the person through imaging, imaging in the X-ray department, and such a person, when they are praying, there's a certain part of the brain which lights up. And this discovery really excited me, that you mean we are spiritually wired, yeah? So those are the 4 elements when we are talking about health. Go to the next slide. And the next slide, we are looking at who is a mentally healthy person. So a mentally healthy person is one who is able to realize his own abilities. And somebody, you realize your ability. You're good in one thing more than the other. Everybody has his talents and weaknesses. Everybody has his abilities, yeah? So a healthy person, a mentally healthy person, is able to cope with normal stress in life. And we all encounter stress in life. I think there's somebody's microphone which needs to be muted. Yes. We all deal with stress in life. And God made us in a way that whatever stress we encounter, we are able to cope, yeah, as a normal individual. But when we have mental health issues, you find it's so difficult to solve a simple problem. You either overreact, or you underreact, or you don't react, yeah? Another element of a healthy mind is you need to be someone who's productive and fruitful, yeah? And I think some of you, many of us may have relatives or friends who we know are undergoing something. And in the process, you find your friend is undergoing something and they are withdrawn. They just sit in one place. They don't go to work. They don't want to be productive, hapo iko problem. Then a mentally healthy person should be somebody who contributes to society. So these are the 4 elements of mental health to determine a mentally healthy person, yeah? So we go to the next slide, where we are looking at the situation in Kenya. Friends, I'm telling you, mental health problems are very, very common in our society. According to the National Task Force of Kenya, about 2 to 3 years ago, they did a presentation to the government, and what they found is that 1 in every 10 people of the population have some kind of mental illness. So if I look at just the number of people who are attending this presentation right now, we are about 300. It means about 30 of us, 1 in 10, yeah? 30 of us, but I believe it's even more, yeah, have some kind of mental illness, yeah? But personally, as a psychiatrist, all my years, I've worked for over 30 years, yeah, 34 years as a psychiatrist. I've never seen a person who's 100% well in terms of mental health. I know somebody may laugh about it, but it's true. We all go through some element of stress or another. But when it becomes more serious, that it affects the way you work, then you fall in the category of 1 in 10 of the population, yeah? Then they also found in the study that a quarter of the patients who go to any general hospital, a quarter of them have mental health issues. They have a mental disease. The ones who have even gone for malaria or whatever in a general hospital. They also found and presented to the government that 40% of all patients who are sleeping in a hospital, 40% is about half, have a mental problem. Now, during COVID time, there was concern 500 people committed suicide from April to June. That's the month of April to June in 2021. And within that time, 500 people committed suicide, and the range of their ages was 9 years to 76 years. So you see, suicide, depression cuts across all ages, yeah? And indeed, the World Bank is very concerned that the suicide is actually very high. The next slide, please. Next slide, please. Yeah, further studies have been done about mental health in Kenya, and they found that over 2/5, that's just less than a half of adolescents. When I'm talking of adolescents, I'm talking between the age of 13 to 18, had mental problems within 1 year at the time they did the study in 2022. Yeah. And they were of the same, male or female, they were more or less the same in terms of numbers. Yeah. So it was quite common. If you're saying over half, I'm sure many of our children were in that bracket. Yeah. Then another study that was done the following year found that 20% of children between 8 and 25 years, 20% have a mental disorder. And they also looked at it. They found between 8 and 16 years, the early teenagers, 20% were mentally ill, had a mental disorder. Then 23% between 17 and 19, these are our Gen Zs, yeah? And then between 20 and 25, 21%. So you can see how almost a quarter, almost is it 20% to 30% of our youth have a mental disorder. Many of us who are here have children who are actually lying in that range. Yeah, so you can now start imagining that it's not something that is too far away. Next slide. One of the commonest mental illnesses in children and adolescents, the commonest, we are talking of anxiety disorder. Yeah. Many of us have experienced anxiety, you know, where you worry, you're anxious, you're restless. Yeah. You lack sleep, your heart beats fast, we call that palpitations. You are nervous, sweating, tremors, fearful, hysterical. Many of us have experienced some element of anxiety. When you're going for an exam, when you're going for a job, interview, or you're going to meet somebody you are hoping to engage, date, and tune so that you get married, we all go through anxiety, yeah? But when it becomes serious and persistent, it gets to anxiety disorder. Then another common one is depression. Depression, I know many of us, even here listening, have gone through depression. This is at the time when you feel persistently sad, yeah? Many of us will go through sadness occasionally, but normally we recover. You can be sad for one day because you have lost or a short time because you have lost a relative, yeah? Or you're sad because something bad happened. But this, to be called depression, it is persistent. It's almost every day you lose interest in doing things. You used to like to cook and clean, but you find you can no longer clean and work. You wake up feeling tired. You imagine you've slept the whole night and you wake up and you're feeling tired. Yeah. You don't feel like going to work. You're more forgetful than usual. You cannot concentrate. Maybe you are not eating well. The appetite is poor, or small things upset you. You are so irritable. Nakasirika upesi. You're moody. In the morning you're happy. You're greeting people. By evening you're irritable and annoyed. And sometimes depression can be serious to lead to suicidal ideas and suicidal death. By the way, suicide is the second leading cause of death between the age of 15 to 29 years in most countries, yeah, including Kenya, yeah. And those are our Gen Zs again, our youth, our teenagers, our children, yeah. Next slide. For the younger children, there are other common mental disorders like the school-going children. As doctors, a lot of teachers refer children to us, and we find they're referred because they have attention deficit hyperactive disorder. We need to know, we call it ADHD. It is just so common that I even wonder how come it is just an epidemic, yeah? Then autism. I think some of you are teachers on this page. You probably can even notice that some of your children have ADHD, some of your students, and autistic behavior. Then for the older children, we're looking at the teens and the youth, the ones we are talking about in that range of Gen Zs. Substance abuse disorder is so common, yeah? And mostly cannabis. Cannabis is just everywhere, and muguka, eh? Cannabis, especially for the young people, it's everywhere. It's outside our houses, the nearest kiosk, wherever you go. You know, you might even decide to move from your house, go to another estate, and still you'll find people who are selling cannabis. It's just so common, and it's everywhere. Then as you grow older, alcohol abuse disorder, the older people now, the 40s, 30s, 40s, paka wazes, 50s, 60s, alcoholism, yeah? Then bipolar disorder is very interesting. I'm finding it very common nowadays. You wake up and you can be very energetic. You're up and about, you talk a lot, you're on your phone calling your friends up to midnight, calling people. You wake up at 3, you're washing the kitchen, cooking and singing loudly, disturbing people. The bipolar is quite common. And that's when you're high. Then when you're depressed, you're withdrawn, locking yourself in the room, and you can also be suicidal. Then other common conditions, post-traumatic stress disorder. I think many of you know that child abuse is common, and it's more commoner than we think. I did a study in Nairobi in partnership with Population Council some 4 years ago. And we were looking at a study where we were looking at how many children in these 2 big primary schools in Nairobi had been sexually abused. Imagine we found about 50% of the children, and they were both girls and boys, about 40 something to 50 had been abused, yeah? And we managed to, you know, in that study, we found quite a number of them were affected, and they were stressed and depressed. So child abuse, neglect, and the abuses are different because there's abuse of sexual abuse. There's sexual abuse where they are sexually assaulted or raped, or they are touched, for example, or there are various forms of sexual abuse, and that's happening to our children. The sad thing is many of them will not tell us parents. They will not tell you because they are scared. They don't know how you will react, because some of the parents are so harsh when they come and say, you know, this somebody did this to me, we beat up the children or blame them or punish them. So the children are just terrified and quiet, and then continue to suffer, yeah? Then, of course, there are other forms of common mental disorder, like schizophrenia, among others. Next slide. The main topic here was suicide. And, you know, suicide is like you've had mental illnesses, but it's not been diagnosed and treated. The condition has become so serious, you were so helpless, you didn't know what to do, end up committing suicide. So suicide is among, it is a serious problem, and is, like I said, is a leading cause of death for children, adolescents, and young adults between 15 to 24. And I have friends whose kids have committed suicide. I've even had workmates who you're chatting with your son, you're laughing, you're having a nice time. Then the son walks off. It's 7 p.m. He walks out of the kitchen, and you think he's just out there, but you call, you look for him. When you go out, you find him hanging on a tree. You know, that is just common, and it's not just one. I've seen several cases like that, yeah? And mostly boys, yeah? Majority of the children and adults who attempt suicide, they have depression. So depression is a big enemy. I see the enemy using this, yeah, in families, in children, yeah. Then amongst younger children, what happens is that the suicide is just sudden. You are feeling okay, then all of a sudden you feel, without warning, you know, you just feel like you want to kill yourself, yeah. And usually they will have depression. There's sadness, confusion, anger, among other things, yeah? But all the list of conditions I showed you in the earlier slide can lead to depression, okay? The next slide. Teenagers usually will feel stressed. If you notice your teenager feeling stressed, doubting themselves, and usually they are pushed by social media. You want to succeed with your peers. And most of the time you're on your social media, Facebook, you're looking at your fellow friends and seeing how so-and-so is successful. Somebody looks so good. Someone looks so cute. The social media has played a big role in causing depression among this age group of teenagers, yeah? Then you feel inadequate, yeah? Like you want to have the same phone, the same pocket money, live in the same house like your friends, and there's that pressure, yeah? And that leads to, is a common cause worldwide of teenagers committing suicide, yeah? And they feel that is the only solution to their lives. Next slide. Looking at the teenagers, if you want to know your child or the child is at risk, or the children are at risk, not necessarily our children. One, depression. You have to look out, are they having depression? Yeah. And then look at family history of suicide attempts. In a family where people have attempted suicide or committed suicide, there's a high risk of suicide in that family, yeah? Exposure to violence. Some of our children, some of the patients I see, they come to me and they have problems. And I always ask them, do you like watching movies? They say yes. What kind of movies? Horror movies. Horror movies and violent movies prepare our minds, yeah, and tune our minds for violence, you know. What you put in is what you get, is what you become, yeah. So exposure to violence is a factor. Impulsiveness. Children who do things quickly without thinking are at risk, yeah. Aggressive or disruptive behavior is also a risk factor. Bullying. Children who bully in schools, and there are many, if you find out, you find in their families, they have been also bullied or they are being mistreated, yeah? But history of somebody being bullied, like especially in the West, and even here, they are high risk of suicide. You've heard of a case where there in Northeastern, there was a girl who was in school and she happened to be having menstrual period, and it stained her dress. And then the headmistress decided to embarrass her in a parade, and she was embarrassed. And when she left there, she went to kill herself. It was in the news, yeah. So those are some of the things that can trigger suicide in children, yeah. Somebody who feels hopeless, helpless, or feels a sense of loss and rejection, yeah, those people are at risk of suicide. That's why parenting is so important. As parents, we have a role to play that our children will find joy and happiness at home. Our children should always feel free and more comfortable being at home, because I know children who avoid home as much as possible, because when they get there, they know there'll be noise or there'll be violence or people will not be free. Yeah, so the parenting is a very crucial aspect to help prevent, yeah, suicide and depression in our children. Next slide. I talked about social media. Now, social media, I've learned quite a lot about social media. There's so much, there are good things in social media, and many of us as Christians, we are learning. Some of us even got born again from some of the social media programs. Yeah, for example, I personally got born again in 2012 from a YouTube presentation from my fellow doctors who were talking about near-death experience and afterlife, and it has had a powerful impact on me. So social media is not always bad, but you really need to pray and be guided, because there are bad sides in the social media. I personally believe the enemy is also very active in that line, in terms of movies, in terms of programs, in terms of like pornography, which is rampant. We cannot stop our children accessing pornography. You see, and some of us want to please our children. By the time they're 8 years, they have a phone. They have a smartphone. And we don't even check what they see. you know. And even you on your smartphone, sometimes you're just talking and you see a pop-up and you see pornography. You never even asked for it, yeah? So these are some of the ways in which it seems it's affecting children and creating mental illness. Addiction. Social media and phone addiction is a problem. And it has brought a group, it has really raised a group of young people who have lost their ability to relate in the family, to communicate with their brothers and sisters and parents, because they come home, they just say, hi, hi, oh, mom, they eat, then they go lock themselves in the room, and that's it, they're on social media until midnight. So we need to encourage our young people to moderate the time they're on social media. Yeah, we have to encourage them to be on, to watch the right things and to be able to moderate, control their time. Otherwise, the mobile phone can be an idolatry. Yeah, so you have no time for God, no time for people. It's just that social media, Facebook, and such. Facebook has also brought a lot of mental illness, young girls being stalked by predators. They are predators, they are men, and many of them are men, but I think they're also women as well right now, who actually try to seduce young people through the social media, become friends with the intention of sexually meeting them and sexually abusing them, yeah? And that is when you discovered, one girl discovered that she was used and misused, and she was very friendly to a man who seemed so nice, on Facebook. So she left, got in a matatu from out of Nairobi, came, met the person who raped her, and left her depressed, suicidal. Yeah, so we have to be careful and alert our children on what they're watching and the kind of friends they are making on social media. Then bullying, horror movies. I've talked about pornography. Next slide. So you have seen a variety of factors that can bring mental illness in children, and these mental illnesses can lead to suicide and depression. Now, I wanted to look at what are some of the barriers we as mental health workers have in treating, in even diagnosing, even for parents. You all agree it's not easy to know if your child is mentally ill. Yeah. One of the reasons is that when a child grows, they undergo change. Like you see your child when he's 8 years, when he becomes 15, 16, he's a teenager. Yeah. So teenager, they want to bond with their friends. They don't want to be so close to the parents. They feel they know more. Yeah. And the teenagers can be difficult. Yeah, I know we have had teenagers. Sometimes they are easily annoyed. They don't talk to you for a whole week, so you think that is normal. Yeah. Another reason is that, and we all know that our children go through stage of development. A child who's 8 cannot be the same as a child who's 15, cannot be the same as a child who's 18. Yeah. So because of the hormonal development, the natural development, you find they develop breasts, pubic hair, and grow. By the time they are adults, you find they are adults and they have other characteristics they didn't have before. So, that is the normal development. So sometimes it's easy for us to miss an early sign of mental illness. Yeah. Again, another reason why detecting mental illnesses in children is difficult is that some of our parents we see, but we refuse to accept because of stigma. What will people say? What will people say when they know that my son is, mentally ill? Yeah. So stigma is a factor. So you'd rather pretend. The other day, I got a parent who brought her child, and she came with her 2 siblings, older siblings, and they complained that their younger sibling was mentally ill, but the mother kept saying she's well. So I had to talk to the child. I saw the child was seriously ill. I had to talk to the mother, who said, no, he's not ill. In fact, the child was even more spiritual, whatever, you know. So sometimes we are in denial that my child cannot be sick because we fear what will people say, people will laugh at me, you know. So stigma is another reason. Another thing is some parents also don't want to bring their children to us to treat because they don't want their children to use medicine. There are rumors that go around, and people are told, do not use medicine for mental illness. Medicine is bad. That's a lie. There's some medicine is bad, but a lot of the medicine is good and is saving the lives of our children. So many parents are misinformed that no, you should not give medicine for this. And also the fear of the cost of treatment. So these are some of the challenges we face. Next slide. So like I said, it's hard to know if your child is developing mental illness. So what are some of the warning signs? You need to see a child becoming sad for long, you know, not just one day, 1 week, but many weeks, many days. Yeah. The child is persistently sad. A child who is normally happy and bright, the way they change, the way they relate with people, staying away and keep locking themselves in the room and keeping away from people. Yeah. Including the family. Another one, hurting themselves. There are many, many girls. I don't know why, but majority of the young teenage girls and Gen Z girls are presenting with, they take a wembe and cut themselves. They injure themselves, you know, when they are stressed and depressed. Yeah. So it is a presentation and it's just so common. And I've never seen that with boys. I've seen it with girls. Yeah. And if you see some of those wounds, you'll be very shocked. Yeah. The same wound, she takes a wembe and cuts, and it's a big, big wound. Yeah. I've seen another girl's arm which had hundreds of blades, hundreds of cuts, you know, and it's so shocking. And they hide from the parents, but when they come to us, they show us. Yeah. So you find that's a cry for help. This is a child who's crying for help. Yeah. And very deep emotional problems. Yeah. And then moodiness, out of control behavior that is harmful, and change in personality and character. Also, poor performance. They you know, they're not performing well in school. A decline in the school performance is a sign, a red flag. Yeah. And the teachers sometimes are the ones who refer the patients to us and say, we have noticed this child is not performing well nowadays. Yeah. And we are concerned. Yeah. So sometimes those are some of the changes. Though I must say, dear ladies and gentlemen, many of our children are living in torturous environments where there's dysfunctional families, there's physical violence in the family, there's no food, you know, there's abuse or dysfunctional parents. One, I know of a family where the father drinks, the mother drinks, but the mother comes in later than the father. The mother comes in midnight. The father comes in at midnight. At least he's more responsible. The father comes in at midnight. The mother can come in at 2 or 3. And I'm telling you, these kids, both of them are just crazy. And, you know, I had to talk to the parents. I had to talk and I've had to talk, you know. So children really suffer. So we have talked about some other warning signs. You find their eating habits. Let's go to the next slide to look at other warning signs in children. Poor eating habits. There's a very serious condition, which is eating disorder, where the child doesn't want to eat. And I'm handling some patients, and we lost a fellow doctor, medical student, who did not eat completely until she died, you know. So eating disorder is a bad and serious problem, especially in Western countries, but I see we are picking it also here, though it's not as common as Europe and America, yeah? But changing in eating habits, poor appetite is a sign of depression, loss of weight, trouble sleeping, yeah? Getting headaches, stomach aches often. For the smaller kids, a depressed child may come and say, Mama, tumbo inaniuma. But you know, unapima choo, you know, you look, there's nothing. but that tumbo keeps ummering him. That stomach will still hurt the baby, you know, and that's like the primary school kids. But when you dig deep, you'll find there's something they are running away from. They are bothered about something in school or at home. They could be bothered in school because they are being bullied, or there's the teacher is, you know, there's kind of abuse, or they can be bothered that they want to be sick so that they remain home, because if they leave mom home alone, dad will beat her. So in cases where fathers are beating their wives, the mothers in front of children, the children look for excuse to be sick and do not want to go to school. Yeah, tumbo, headache, yeah. Then a child who can concentrate, the teachers will know and be concerned. They should actually call you as a parent and find out what's wrong. Lack of concentration, poor performance, and not going to school. Not going to school, school refusal is a sign of a problem in the family. Yeah, and the child is anxious. So a lot of the time when these children present like that, there's a bigger story in the family. The child may be having the depression, but when we take history, we find there are even bigger problems. The father is even more depressed, or the mother is more depressed, and should be the ones coming to hospital, and it's affecting the child. Yeah. So those are some of the interesting findings and warning signs we have to look for. Next. So as we are heading towards finishing, I know many of you are asking, what should I do if I suspect that my child has a mental health problem? Don't delay, don't procrastinate, take it seriously. And here is, you have to consult your healthcare professional. You have to inform, even if it's the nearby nurse, doctor, and then also explain the behaviors that concern you to the doctor, yeah, or the psychologist, and then talk to the teachers. The teachers are quite a number of teachers are very good. I'm not saying all, but there are quite a number of teachers who are sensitive and will do the right thing and be concerned, yeah. But you need to talk even to your friends. Women are good at sharing in the chamas. Oh, my daughter, this, my that. And then a fellow friend will advise you, you go and see a doctor because it happened to my child also. Yeah. So make sure that you talk about it. Don't ignore it. Share this information with a health professional. Next slide. We are also asking, how do you professionals diagnose mental illness? So in children, so for me now, if a child was brought to me, what I would do is, first of all, you know, we just have to take history. I think this slide came to the wrong. Yeah, okay. The mental health condition should be diagnosed and treated, the symptoms treated, yeah, and because it can affect the daily life of the child, they need to be referred to a mental specialist. Yeah. Now, a mental specialist can be a psychiatrist. We have psychologists who are trained, and psychologists can assess and pick up a diagnosis and refer also for urgent treatment. Clinical social workers, psychiatric nurse practitioners, and other health professionals. Yeah, they can actually detect. Yeah. So when the child goes to the next slide, please. When a child comes to me, for example, as a specialist, I will take full history, yeah, and find out, when did this start? Are there other sicknesses before? How are the family? How is the family? How is the relationship? How is schooling? How was the pregnancy of this child? Was the mother sickly? Because one thing we have found, a pregnant mother who is depressed or suffering is likely to give birth to a child with depression or rejection and other things. So usually we take history, yeah, of the parents, how they gave birth and all that. And then history of the physical illness and emotional trauma. If you are beaten, or if the child was raped, when was it? How many times? What happened? Yeah. Is there family history of mental and physical illness? because we have found that family history of mental health is a risk factor. So, and I know many of us do have relatives, parents or uncles or brothers and grandparents who had depression or mental illness. So we need to know that we have a risk ourselves or our children of getting mentally ill. But it doesn't mean they all will get ill, and it doesn't even mean they necessarily will get ill, but we have a high risk. Another thing, as a psychiatrist, I look at the symptoms and see what is the child presenting with. Is it lack of sleep? Is it loss of weight? Is it locking herself in the room? Is it confusion? And what worries you as a parent? Yeah. And then in that, we also want to find out how old is the child? Because if you see a child who is 4 years old and is running around and playing, you know that that is normal. The parent should not worry. But if it's excessively, then you'll worry, could this be ADHD? Yeah, because the child is hyperactive. So we also look at the age of the child. There are some activities which are normal in certain ages, and some activities which are abnormal. Like a child of 7 can climb a tree. Hiyo ni sawa. Lakini a child of 18, 19, 25, you know, there's something, yeah? That's not quite so normal. So we also take school history. How is their performance? We ask the teachers to do a letter, to do a report on how is the child performing. Is the child disciplined and obedient? Is the child relating well with other children? So a letter from a school teacher helps us in coming up with a diagnosis, yeah? Then we also talk with the parents. We have to talk with the parents, yeah? And sometimes we talk to the parents and ask the child to go outside, yeah, because they hear, yeah, and we ask deep questions to the parents, yeah, and sometimes we even talk with the child and we may ask the parents to go outside. And as we are talking with the child and he's sitting with the parents, we watch the behavior inaitwa body language, because a child who is being abused by the parent, you can tell when they sit in that room, you can see the body language and you can say, huyu mtoto anaogopa mama yake. Yeah. We also ask the children to draw pictures. Yeah. I usually tell them, go and draw a picture of your family. So the child, as I'm talking to the parents, we give a big piece of paper and color pencils, and the child goes to the next room to draw a picture of the family. That one will tell you a story. The child may draw a picture of the father standing in one end, one corner, with a very big mouth and sharp teeth. Then there's a gap between the father and the mother, who is close with the children, yeah, and very nice face, nice, yeah. Then you know already there's a story here, yeah. You know, that's how the young children are. They express themselves through drawings, through stories, yeah, but they cannot express themselves verbally. They don't have the confidence. So when they draw pictures or you give them toys to play with, and a child who is raped, if you give him toys of different toys of male, female, the child will enact what has happened to her, yeah, and she will just show it with the doll and play, and you know, and it will tell you something has happened, you see. So there are ways in which we test. Let's go to the next slide. And it's very interesting, yeah, when we are diagnosing our children. So let me alert you that it takes time. It can take 2 hours, and it can even take separate days by the time we come with a conclusion about a diagnosis of a child's condition, yeah? Because children do not express themselves easily, yeah? And maturity of the child will vary. There are some who they are big, but they have a child, the maturity of a small child. They are big in body, but small child, yeah? And then another challenge here is that many people are involved in the illness of the child. Yeah, the family is involved. It's not the child alone. But we need the cooperation of the parents. When we don't have cooperation of the parents, I'm telling you, we have problems. We do not move very far. Yeah, we need the mother and the father. And even if there's no one parent is missing, at least one parent has to be there, or a guardian. Okay, let's go to the next slide, please. We're about to finish. So how do we treat these children? We have diagnosed, for example, depression. Yeah, and we have diagnosed that depression could be due to child abuse, for example. Then the first line is to make sure that the child is safe. I had forgot to insert that. The child has to be removed from the dangerous place where the child is. When I was working in Kenyatta in psychiatry, I would sometimes call the children's department to rescue children, to rescue a particular child from his house and bring to hospital, because I got information that this child is being abused, so that we are able to do psychotherapy. Yeah, we are able to evaluate the child. Yeah, and psychotherapy is talk therapy, and behavior therapy, talk therapy. It is very good. Yeah, to reassure the child is not his mistake, because when children are being abused, they blame themselves. When parents when parents are fighting each other, the children blame themselves. It's because of me. That's why my mom and dad are divorced. Children blame themselves. So we reassure them that it's not their mistake. We reassure them that we have to make sure they're safe. And then children, through, depending on the age, through times, stories, playtime, games, yeah, we are able to counsel them through games, toys, yeah, play, storytelling, and you find they fit in very well. And so that it's like they're enjoying themselves, and in that enjoyment, their story comes out. It could be from the games they are playing, the stories they are telling, the pictures they are drawing. Yeah, they will not hide. If somebody is being sexually abused, they draw everything, everything. Yeah, and the same in terms of emotions, they can do expressions. They might even draw a very aggressive mother, maybe has very big hands, you know, very, very big hands. There are some mothers who are more aggressive than the fathers, and they overpower everybody. So the mother has a big body with big hands. The father is a small body on one corner with the children, and the children may have no hands. When a child draws a picture of himself with no hands, that is sense of helplessness and hopelessness, you know, and it tells you also a story. Then through psychotherapy, you can also teach the children to learn new behaviors and coping skills. Yeah. Yeah. Next slide, please. We're about to finish. Then there are some children who will not respond to psychotherapy alone. And we then are forced to use medicine. For example, ADHD. ADHD is a chemical imbalance in the brain that psychotherapy alone cannot help. Yeah, we have to use a stimulant, and we have very good safe meds, and that within 2 weeks, 3 weeks, a child who's hyperactive is settled, and the parents come smiling, and within 3 months the child, even the teacher says, he's really improved, he's doing well. Yeah, so medications come in when you find the therapy does not work, or when the child is so depressed, is suicidal. That one you don't wait. We give antidepressant, we put them in a safe place, we give them therapy, and we sometimes admit them. We've had to admit 10-year-olds in our hospital. We've handled them. They were very, very sick. So 10 years. Otherwise, most children, we manage them with their parents in their homes, unless they become really, really difficult. Yeah. Antipsychotics, yeah, for very aggressive children. But there's one time an American family brought their 4-year-old to see me. And that 4-year-old, I didn't give medication, because the 4-year-old was psychotic. Yeah, talking about seeing a woman hanged on the ceiling, hanging, and then some harms producing protruding from the wall. And it was so obvious this child was very, very quite psychotic. But then when I asked the parents, hey, what does this child do? Does he entertain themselves? Oh, we love to give him horror movies, likes to see horror movies, you know. So I had to sit with the parents and I said, please, please, please stop, because this child has now embraced those horror movies and it's part of his life. You know, hanging woman on the wall, you know. Then another common kind of psychosis I've seen is hearing voices and being visited by people. They are the good people and the bad people. And there are voices who will tell you, you kill yourself, you're useless, you're nothing. Then other voices say, no, 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 you're nice, you're okay, you know? So those ones are challenging. And I usually combine those ones with the spiritual therapy as well. Yeah. Next slide. So we have talked of medicine, we have talked of psychotherapy. Social support is necessary. People have to be there for you. You know, people, family, friends, you know, people who have social support are likely to recover quickly from mental illness than people who are loners with few friends. That has been researched, yeah? So friends and social support, I thank God for Africans. We are very social, yeah? And the family system, friends, relatives is strong. So for us, this is a plus, when we are handling depression in children, yeah? Next slide. Sorry, just go back to the earlier slide. The community and school, just go back to the earlier slide, please. Just the one before this one. The one of social support. There's something I wanted to emphasize. Yes, the issue of schools, we really have a challenge that sometimes our children are depressed, stressed, or they have ADHD, but the teachers may not understand and punish this child. And the more they punish this child, the more likely this child can commit suicide, because already the child is unwell. So in schools, children who are disruptive or who have a problem should be sent for assessment, because sometimes they have ADHD, or they are victims of child abuse in their families, or they have learning disorder. You know, a learning disorder, you can be born with a condition where you cannot do mathematics, but you can do English very well and others. So you get caned when you perform poorly in maths, but they've got to understand it's a learning disorder. It is something in the brain and it needs help, yeah? So let's go to the next slide, please. And I think this is the second last or so, but I brought it last because it is so important, yeah? For us, for me, we have practiced, we do apply spiritual therapy in some cases in our hospital, yeah? And this is very important. As a Christian, we use the Christian model because most of our patients are Christians, yeah? But we do not force people to do this, but we encourage. Now, one thing I've noticed is that there's a case we handled who came in psychotic, and she was not typically psychiatric, because if you saw her behavior, it was strange, like walking backwards. The movements of her body and her behavior were kind of unnatural, like walking backwards down a flight of stairs at 3 a.m., or seeing demons or seeing all manners of things. And in this particular child, she admitted to us that she was in school, she joined an occult movement. And we need to know that in many, many, many of our secondary boarding schools, there's occult, there are children who are in, okay, they call themselves Satan worshippers, or in occultic activities, yeah? And they are recruited, they get recruited, and in that process, their leaders access money and they do all manners of things and practice witchcraft. There are so many stories we hear about this. So this girl had been involved in such a group. So so when we saw her, we realized that there was something spiritual. Yeah, there was something spiritual in this child. She was exposed to the occult, and she was also anxious. She had the parents had issues. Yeah. So what we did, we took history. Now this is history to find out what are some of the open doors. Open doors is doors that the enemy can come in. Yeah. So open doors, we look at the family tree. Could it be that the grandmother was a witch or into witchcraft, you know? And I have to alert all of you, as Africans, a lot of our parents or grandparents or forefathers have been involved in occultic or witchcraft practices. I don't know if it was part of the culture. I can't explain, yeah? But sometimes those opened doors to the generational curses and illnesses. So we take history, yeah, to see what sins were committed. We identify doors that were opened that offended God, yeah. And then we have to lead the family. And with children, we must start with the parents. You can't treat a child when you're doing spiritual therapy. You can't help a child without, first of all, involving the parents or the close guardian. So the guardian needs to be somebody who is spiritually strong, yeah, because the guardian is the authority figure over this child, yeah. So we lead the child and the family to accept Christ. That's the first step. And then we lead them to identify the spots that were done, the wrong things that were done that could give rise to bitterness and anger. Bitterness and unforgiveness is one way the enemy opens doors and can fill you with all kind of mental illnesses, yeah. So we lead them through Bible verses to repent, to ask for forgiveness, yeah, or to forgive those who hurt them. People who have been raped, we encourage them to forgive, and that's a very hard journey, yeah. Forgive all those who have done wrong to them and pray for them, because that one they're healing, they're healing themselves, yeah. And then we pray for restoration. It's a process, yeah. And then in the end, may God restore you and your family back to Him and disconnect the child and the family from ancestral sins that occurred in the past, yeah. So this is like a kind of an inner healing process, and this is a spiritual approach. And it worked for this particular girl who I treated, who was walking backwards down 2 flights of stairs, and she became spiritual. She got born again. It's a good story. She went back, she finished Form 4. She is a lovely, beautiful girl, you know, and it's amazing. Yeah. I actually even presented her case to the doctors. So the next slide. So I've talked about inner healing. Spiritual therapy is part of inner healing. I've already mentioned. So for children, for adults, it's easier. For children, you have to do the same, but using toys, games, drawing, storybooks about Jesus Christ, stories about the Bible, you know, and you have to work closely with the parents. And sometimes it means you are lying on the floor with toys, books, yeah, and playing games with them. Then you integrate Bible stories so that they can identify themselves with the stories in the Bible, you know? Yeah, and that's one way in which we do and emphasize healing and forgiveness. And Jesus is our healer, and the reading verses. But even after this process, really, they must be committed. They must pray every day. They must be spiritually strong. Yeah. And the parents have to be spiritually strong. You don't want to open more doors to this child to have the same problem once again. I thought that was the last slide, but there's one now. I know we are asking, how can I help my child? And some of you may have children or relatives. Wow, you are special. You have a huge role to play in helping your child, but you have to be knowledgeable. And this seminar is empowering you with knowledge about mental illness. So you start there, know about illnesses, because I've had parents saying, oh no, my child is not ill. It's not true. And others believe it's just witchcraft, you know, and sometimes it's just sickness, you know. So we have to be knowledgeable. We have to do family counseling. When we counsel treating children, the family must be involved. And then we basically what did we say? Yeah, we train them how to handle the child, how to respond to the child, and handle the child when they're having temper tantrums or misbehaving. Because sometimes the way we overreact, we only make the child worse. Yeah. So, like now in our hospital, we have a day program for daycare for parents or patients who need to be trained on how to take care of their patients after discharge. Yeah. So that and we have to just look at ways of handling stress also, relax, and praise our children. A lot of the time we quarrel our children when they do wrong, but we forget to praise them when they do right. A child needs to be affirmed and praised when they do right, because they'll keep doing the right thing. Because any human being wants praises, even adults. So when you are doing good and you're praised, you want to be good because you want to be praised. Yeah. And then we also work very closely with the schools because of the support they need. So I think that's true. The last slide is just thanking you for allowing me to share. Yeah, go to the next one. I think I already talked. Yeah. So thank you all for listening. I know it was very long, but I hope it was useful and important. I work at Oasis Mental Health Hospital, and we do see children and adolescents and adults, and we manage also addictions and challenging spiritual cases. Yes, I work closely with our Reverend who is with us. We have Reverend Joel Masawi and a chaplaincy team when we have cases that need such a journey. My contacts are there. You can see the phones for the hospital. Yeah, so I welcome questions and even contributions. Thank you.
Thank you so much, Daktari, for that presentation. It's been wonderful. Now, we have a few minutes and we want to pick some questions. There are some questions that were already asked in the chat box. So I have a team that I will give an opportunity to read one or two questions. If they're ready, Esther, Amadilo, anyone who is ready with any of the questions already shared, feel free to unmute and share. As we wait for them, if you have any questions, just raise
for a question online on the chat.
Oh.
So my question is that maybe I know the Dr. has mentioned about the symptoms of mental health. So there's a question I asked for pre-teenagers because they go through a lot of chemical changes. I think she's also mentioned that. But maybe what if you see a once-off behavior, maybe when you correct a child, and then you see them maybe going to maybe tear papers or do something like that. Once off, not something that is always there. I don't know whether that can be classified as something that needs attention, or does it have to be constant, or does it have to repeat itself, or repeat as a mental issue?
Okay, that's a good question. Do you want to ask more questions?
Yes, I have Seko Bernard. Hello? Hello?
Yes, Bernard. Go ahead, we can hear you.
Yes, I have just this question. I'm having one child so far, and this child is just addicted to, she's been, I think the mom has gotten used to a phone. So I was just asking, what kind of mental probably illness can this child develop? Because I realize I don't stay with her, but more or less when I visit them, they just have the child cannot just get away from their phone. So probably what are the effects besides the sites that could be dangerous? What is the long effect of using the phones? The child is about 5 years, going to 6. Thank you.
Okay, another one.
Hello, brothers and sisters. I have a question. I wanted to know most of the signs of mental health illness that was mentioned there. Some of them I may pass through that when I was a child. So I wanted to know how, as an adult, may I know that I've overcome that, or I need to go check a doctor. And if I haven't overcome that, can I be able to help like a child has going through? My wife is expecting a baby, and so we are just learning as much that we can about this subject. So thank you.
Hello, good evening. I have a question on ADHD. How do you curb a baby, let's say a child who has ADHD? And is there any way, apart from medication, that we can be able to sort it out as a parent? And also, when you have a hyperactive kid, what ways or any way that we can be able to manage that kid from being hyper? Because at times as teachers, and also you find you have a very hyperactive kid in class, but you cannot also be able to control the kid. Anyways, for
Good evening. I also have a question. Thank you so much for the good presentation. I focus a lot on men and boys and their mental health, and I'm interested to find out whether we have researches that have tried to unravel why is it that we have more men.
Hello? Sorry,
Sorry,
I've not had.
thriving
Why?
thriving communities. Sorry, you're muted. Please go ahead.
Okay. Can you hear me now?
Yes.
Why is it that we have more men and boys dying of suicide or having mental health illnesses? Like I have noted that we are having more boys having autism. Do we have researchers that have tried to understand this, and what is the science behind this, or what is happening? Back to you. Thanks.
Hello, my question has to do.
I'm thinking, could I answer some and then take another batch in case I forget?
That's in order, Daktari. Answer those ones, then we take the next round of questions. Go ahead.
Okay, the first question was on pre-teenagers. A pre-teenage child who comes and suddenly tears something and just reacts in a very impulsive way. I think if you look at it, all of us have gone through that. All of us have had those impulsive reactions, you know? And I think that you just need to look at normal unless it is repeated, yeah? Unless it's repeated, this teenage is repeatedly behaving like that. And then another thing, if that behavior is disrupting the child's relationships, schoolwork. And then number 3, are there other symptoms? Like, is the child looking sad? Is the child withdrawn? Is the child performing poorly? Then you know this is time to actually refer. But otherwise, what you do, engage that child lovingly and just tell them, look, this was not right. I know you were angry, but please let us learn to control ourselves. Number 2, addiction to phones is a big, big problem. Studies have shown that children who are addicted so much on phone, their brain development is actually being affected, and it's impacting on functions, cognitive function of the child, so that the child is spending a lot of the time on social media, is less likely to be brighter or creative, yeah, or better functioning than a child who is engaged in reading, games, swimming, singing, etc. That study has been done. So this child needs to be educated and just told, okay, I know you love the phone, but by the way, you need to know that too much of phone is not good. You need to moderate, yeah? And our mistake as parents, you give the child a phone from 8 years of age, and you don't even want to check what they are watching, you know? So a lot of the time it's our fault. So you want to start checking when they're 15 years. Do you think this child will be happy? They'll just insult you, yeah? Then the next question was signs of mental health, overcoming, we experience as children. What was the question? How do you know if you have overcome? Okay, there's somebody who experienced some of these symptoms in childhood, yeah? And with time, those symptoms subsided. There are sometimes conditions where you may be hyperactive. I personally had my daughter who was overactive. Actually, I sought medical advice when she was about 6, 7. She was so active in primary school. And the school actually were thinking of sending her away. But then I took her to hospital and said, no, she must be overactive and not having hyperactive as such. But what we did, we talked with the teacher, and the teachers decided that let them give her duties. Like she was given the job of house prefect, class prefect. And you found that hyperactivity went down. The only thing is she wrote everybody's name. Everybody was naughty, everybody. And the teachers laughed about it. But from that day, they stopped complaining about her, yeah? There are some cases where you're just overactive, or you could be borderline, yeah? And if you get better, hallelujah. We just say hallelujah, yeah? So it's, like I said, many of us have experienced some of these symptoms at one time, yeah? But if it's not persistent and it's not impacting on your life, don't worry, yeah? Then another one is you have, your wife is pregnant and you're concerned. You don't want children who are stressed. Can you hear me? Hello? Yeah. So
Yes, we can.
the wife who's your wife is pregnant.
We can hear you.
Yeah, when the parents are relaxed, they have a good relationship, the wife is happy, she's eating well, she's exercising, she manages her stress well, you don't need to worry. Chances are that baby is going to be fine. Then of course you have to parent the child well, okay? Then the other one is about ADHD. ADHD is it's a neurochemical condition. There's a neurotransmitters in the brain, which is abnormally low, and these are, they're called norepinephrine and epinephrine, and they're abnormally low. And because of the low neurotransmitter, the brain cannot function as it should. So if it is mild, perhaps we can try occupational therapy, behavioral therapy, yeah? And like today, just yesterday, I saw a child brought to me. We diagnosed strong ADHD, but the mother opted first and foremost to try occupational therapy, yeah? And then we see, but we must follow up. If we find it's not working, then we may introduce a low dose of, it's called Concerta. Concerta is a stimulant which works so well, because within 2-3 weeks, 1 month, everybody notices an improvement. The child is happy, the teachers are happy, the parents are happy, because that chemical is being corrected, yeah? Then there was another one on men and boys. It's quite a challenge that I think that actually statistics show that more women get depressed, but more boys commit suicide. But I'm thinking is that women tend to go have chamas, they go to church. If you go to any church, you have to agree with me, majority of the people there are women, you know, and women are likely to be more expressive, share amongst themselves. You know, a woman is likely to talk about her husband mistreating her to fellow women than a man is likely to talk how his wife is mistreating. So I think that cushions women. One, the prayer, the spirituality. Two, they're more expressive, yeah, and the many chamas you see we are in. Men don't usually have chamas. Many do not go to church, but they may go, but still they are they will not share easily, yeah? So I don't know, but I think that could be one reason, yeah? So we're encouraging men to be more expressive. I think the boy child is at risk right now. So much attention is given to girls, but we are forgetting now about the boy child. Yeah, I can take more questions, please.
I have a question. I have a girl who the mother came to me. She has been expelled from school because she has become like a bad influence. She's an introvert. She doesn't make friends. She's ever messy on the phone. Her performance has deteriorated, but last year she had tried committing suicide. She was taken to a psychiatrist, psychologist. Then she said there's nothing much they can do to help. She says no one can change her mind. She wants to kill herself. But when they checked to the history on the phone, they realized that it's like a cult she has joined. Now the mother is desperate. She doesn't know who to turn to or what to do with her. But she comes to church, but she doesn't talk to anyone. She doesn't have friends. She only talk to things. Now, how can we help her? Thank you.
Okay.
Okay.
I'm sorry, you were
I have
echoing.
another
I
question.
didn't hear very well. There was a lot of echo, but I heard that the girl is withdrawn with few friends.
Yeah, and she's trying to commit suicide. She had tried
Okay, I
again
have
to commit
a question.
suicide.
That's an emergency. Emergency, please bring her over, or we need to refer to a doctor.
Okay.
That's an emergency. Yeah, she has a high risk.
Okay, thanks.
And by the way, the law allows you, if you refuse treatment, anybody,
Yes.
including especially your parents or relatives, can carry you against your will and take you to hospital.
Okay.
And you'll be treated,
Okay.
and you're the first person who will be very happy. Yeah. So such a person, if she is not willing to come, get people to carry her, put her in a car, bring her, we treat her because she's not herself. Okay.
Okay. Now,
Yes, I have a question.
let's go to Wapella and then Rose iPhone. Wapella, go ahead.
Okay, good. Hello, guys. Thank you so much for their presentation. It was very interesting. And I have a lot of questions, but I will do just one. I want to know how we can deal with the hereditary disease if we have a family history. If we had in the past some situation with one of our family, how we can do if these years have some connection with the past, or we just a situation with this time with our children, like Sandra said before. Thank you.
Yeah, thank you very much.
I'm sorry, I've not heard it well.
Oh.
Please kindly can I've not heard her well. Can somebody help me? About family history? I think there was noise, so I couldn't hear you very well. About family history.
What I heard is, how do you deal with the hereditary diseases?
Yeah. Okay.
Yeah, something like, yeah.
Okay. Yeah.
All right. My question has to do with the interventions that you mentioned. You mentioned one of the interventions is medication. So if you begin, let's say, an adolescent on medication, how long would it take to begin to see results, and how long until they recover? Or would this be lifelong medication? Is there a time that comes and the person can stop medication? Is it lifelong? And 3, how soon do you begin to see changes in the mental health and behavior? Thank you.
Thank you. Next.
Thank you, George. George, go ahead. Then KCPF.
Yes, thank you very much, Doc. My question relates to the interventions or through spiritual therapy. I've experienced situations where we have people, especially in the church space, getting stressed, going all the way, getting depressed, and then ending up either forcing themselves in quotes to starve to death, or actually even committing suicide essentially. How do you, what's your comment around how that can be integrated within the church setup and how effective it can be, especially when it comes to people who are deep spiritually? Thank you.
Thank you. KCPF, your hand is up. Okay. Rogers Aluda. Okay. Galaxy A20s.
Hello?
Yeah.
All right.
Are you hearing
Yes,
me?
Rogers.
Okay, my question relates to the stress our children are.
Sorry, I can't hear. Hello.
Rogers
All right,
is muted.
we have lost him.
Hello?
Hannah Wanja, go ahead. Then we go back to Rogers.
Please guide me on
Hi.
the intervention for a child who is under autism. What intervention do you offer?
Okay.
Okay.
So let
Thank
me
you,
answer
Hannah.
this.
All right, go ahead, Daktari.
Okay, the first one was about hereditary disease. There are hereditary diseases that are treatable, like depression, and they are not curable, unfortunately, most of them. They're treatable, and there are those that are not treatable. First thing is you have to educate ourselves and be aware that condition we have, we are at risk because our mothers or our fathers have had depression before. And it's not just for depression, also diabetes, hypertension, those are also hereditary. So once you are aware, then you focus on prevention, yeah? You have to work on prevention and early prevention of stress, for example. If you know that your family is your mental illness, then don't stress yourself so much. Deal with your stress. And one ways of dealing with your stress is also prayer. Spirituality is known by doctors have found that it's preventive, yeah, of mental illness. So spirituality, we encourage people to be spiritual. And I'm very proud to say it from a scientific point of view, because many medics will not want, now you have an explanation, a reason why, yeah, so hereditary is basically that. Some are treated, some are not treated, but when you have knowledge, you're better off in understanding and dealing with it better, yeah? Then the other one is medications. The beauty is that a lot of the medications we have, like for ADHD, within 4 weeks, the teacher, the parents, and the child are gonna come and tell you, wow, she's doing well. She's able to finish her assignments. Now she's settling. She's not hyperactive. Now she's able to play with children without beating them, So usually for like ADHD, the response is earlier. Depression is even earlier, from 7 days. A suicidal patient like the one that somebody has just mentioned is suicidal, whom I've said should be brought immediately. Within 1 week to 2 weeks of medication, the serotonin levels stabilize. These are the neurotransmitters in the brain. And within 3 weeks, they are smiling. Within 1 month, they're able to go back to their families, to go to school, to go to work, etc. So it's amazing how the science is advanced in the medication that is able to treat, yeah? But also we like to combine medicine with therapy again. Then the other question is, and yes, you may be, some of it is lifelong. Some of the conditions subside polepole. Like I've noticed, ADHD, children can start with very bad ADHD. You may even start with some of them with 1 or 2 drugs, but with time you find they are more calm. So I've had to reduce the medicine to 1 and then settle on one. But most of this medicine is lifelong. But of course, there are miracles where even you wouldn't understand, where this person had depression and you find they're doing well. So medicine works with social factors, spiritual factors, psychosocial factors. If you are in an environment that's good, you're doing the right thing, eating well, the best support, maybe you might not need the medicine all the time. Yeah. And then on spiritual therapy, it's very interesting. Spiritual therapy is one area which is complex. There are not many hospitals that actually even come up. Okay, we talk of chaplaincy, but define exactly how this spiritual therapy is done. But one, you need to sensitize the medics in the hospital to know when do you need to refer for spiritual therapy, and when do you need not to. Yeah, because some of our people are some of the patients come in and they manifest with spirituality being over religious. For example, some of our patients come saying, I'm God. And yes, yeah, but he cannot be God. That's a delusion. Yeah. So there's that thing. Or some say, I'm Jesus Christ. Oh, I am a prophet. Those are very common ways in which a lot of our psychiatric patients are presenting. And it makes us wonder why. And even a study in the US found even atheists and other people who never used to go to the bar, when they broke down, they start talking about Jesus. So I don't know whether this is a way that God is pulling them and calling them. It's interesting. In the church, we have cultism as a big problem. There are those of us in the church, but some get lost because you got in touch with a false prophet and then you got into a cult. And that false prophet, the enemy uses the false prophet to confuse all these people to kill themselves. And there are many examples of cult leaders like Jim Jones in Guyana, the one we had in the coast, and many, and even some we are even having now. And many of our churches have cult leaders. We are in a cult and we don't know. So you have to be careful and just check where you are, that you're not in a cult. Yeah, who blindly follows a leader even when they tell you things that are not biblical and not practical and not of Jesus. You ask yourself, what would Jesus do? Is this of Jesus? So these persons who are starving themselves, I think they got lost long ago. Yeah. Yeah, because that's not Jesus. Jesus never encouraged you to starve yourself to death. Yeah. And then somebody talked about stress in children. I didn't hear that very well. And then autism. Autism is a lifelong condition. It's a neurological condition. Something goes wrong with part of the brain such that the child from the age of 4 years onwards cannot communicate normally. Yeah. You smile at the child will not smile back. You talk to the child and they will not recognize this is mommy or daddy. They are not able to communicate. They will have repeated activities. You can play with one ball for 6 hours. You're standing in one place playing with one ball. And that condition has not even have a cure, does not even have medication, unlike ADHD, which has medication. Now, autism, but the autistic children, some get depressed. So normally we assess the autism and notice if they have also ADHD, we treat the ADHD. If they have depression, we treat the depression. But the autism does not go. But we encourage behavioral support, behavioral, you just engage them with love. You have to, the family need to know how to handle them. But you shouldn't expect that person to become a lecturer, doctor, or a driver or such, yeah? But you give them whatever support they can and whatever they're able to do through occupational therapy and such is what you can do the best way you can do it, And there are cases, like in any illness, there are cases you cannot heal, you cannot treat, while there are others that can be treated. Next question.
I had started sharing. I wanted to ask about this girl who is in Form 3 right now. Has attempted suicide severally, has done all this self-harming, but still feels like she doesn't need to see a counselor, how or whatever, how can she be helped?
That's an emergency. That's somebody, you simply go to this Form 3, you get to the parents or the caregivers and let them just go to her and say, dear, we love you and you're not yourself. And we are concerned about you and we feel you need help. We are going to take you to the hospital. That's how you go. You don't give them a choice. With people with mental disorders, you don't go and say, oh, especially serious ones that are life-threatening. You don't go and say, oh, please, don't you think the person is not in his right mind. He will, if he wants to kill himself, why should he go to the hospital? So the law allows you to take over and bring the patient. The beauty is that when you bring them to us, we know how to handle. Within the third or fourth day, the child is smiling, the child is happy, the child is appreciating, yeah? And within 1 week to 2 weeks, the child is ready to go home. Are you seeing? So we have to just be
Where are you
assertive and
situated?
firm. Oh, we're in Westlands, Peponi Road. That's the road of Westgate, that road that passes along Westgate. And if you Google map, you'll get us Oasis Health. Yeah, Oasis Health on the Google map.
Okay. Thank you so much, Daktari. We are already past time, 14 minutes past time. And the contacts of Daktari are shared on the screen. So you can easily reach out to the hospital so that you're able to get assistance. Now, before I invite my colleagues so that we conclude this, I just want to mention that we normally have these webinars many times, and our next webinar is on 7th October. And our speaker is Dr. Stanley Mukolwe. So he's continuing something that he started in August. He started with a topic on fatherhood, and now we are into dysfunctional families and seeing how to help, whether to the children or to the people involved. How do we help and bring hope to those who are in this context? So please note that, and if we don't have your contact, feel free to reach out to us. You can either put it on the chat box so that we're able to give you more info when the fly is out. Otherwise, I would want to thank you, Daktari, for sparing time, actually extra time to respond to these questions. I know we cannot exhaust all the questions, but feel free to reach out to Daktari. The contacts were already shared. Or if you lose the contacts, you can also share them to us so that we're able to connect with Daktari and you continue the conversation. At this point, okay, thank you, Daktari. Now, Daktari, before you go, your last words. Because after this, we just summarize and finish.
We are our brother's keeper. We are all our brother's keeper. Let's be concerned as Christians about one another, each other, because any of us can be depressed, and our children and even our neighbors, you know, even our neighbors. Now that we are knowledgeable, we are all mental health workers to some extent. So I'll encourage us as Christians that you're a mental health worker in one way or another, and that your support and love will be appreciated by God. I'm talking for God, but I believe so. Yeah, thank you. I loved talking to you and I loved your questions. Asante.